All right, the next topic we're now going to cover is called Neuromuscular Physiology. This is all about muscle physiology and muscle contractions. What I want you to get out of this video is a very organized way to think about muscles and what they do, and know how to organize your knowledge concerning the three types of muscles, which is skeletal muscle, cardiac muscle, and smooth muscle. Now, in this subject, we're going to cover a lot of autonomic drugs, because the autonomic drugs play a big role in muscle physiology. So we're going to start from the beginning. We're going to look at how the brain controls all of this. So whenever you hear the term central nervous system, it means it involves the brain and the spinal cord. The brain and the spinal cord. What does that mean? The reason why I'm teaching you this is because if there's a question that has the phrase central nervous system, then make sure your answer has one of the words, either brain or spinal cord, in it if you want to get a point. So the term central nervous system means brain or spinal cord has to be involved in your answer. Then the central nervous system can be divided up into two sections, two divisions. One is called the parasympathetic system, and the parasympathetic system controls head and neck and below the belt. So craniosacral divisions controlled by the parasympathetic system. And then the sympathetic system controls in between. That'll be the thoracolumbar areas, rather. Now, how does that help you? It helps you in organizing your thoughts. So that means if somebody asks you, well, who controls dreaming? You say, well, dreaming is head and neck. You say, oh, okay, parasympathetic. What if they ask you, well, who controls urination? Well, you say urination is below the belt. So you say, oh, okay, then parasympathetic controls that as well. Well, if they ask you, well, who controls the birthing process? Well, you say, well, birthing process comes out below the belt. You say, okay, parasympathetic system controls it. Whereas if I ask you who controls your heart rate, well, you say the heart rate, that's thoracolumbar area. You say, well, sympathetic controls it. So this allows you, again, a quick organizational pattern to use in answering a lot of anatomy questions. So central nervous system, think brain and spinal cord in your answer. Parasympathetic, think craniosacral divisions. And sympathetic, think thoracolumbar divisions. All right, first, the inhibitory neurotransmitters. Gaba is the main inhibitory neurotransmitter for the brain, and glycine is the main inhibitory neurotransmitter for the spinal cord. So remember we talked about in neuromuscular phys, or rather membrane physiology, that the rest of membrane potential for all the membranes in your body sits at -90, but for the neurons and the Purkinje fibers, it sits at -70. Well, if the membrane potential sits at -70, and you're asked which way will chloride move, you say, well, chloride will move inside the cell. Why? Because the membrane potential that's most comfortable for chloride, which means the Nernst number for chloride, if you remember, is -90. So if the Nernst number for chloride is the same as the rest of membrane potential, chloride does not want to move. Remember, we discussed this in membrane physiology. However, in the neurons, where the membrane potential sits at -70, chloride will gladly move into the cell to drive the membrane potential back down to -90, where he's the happiest. So again, in the brain, -70 is the rest of membrane potential, so chloride movement into the cell would be easy to do. In the periphery, that would not happen. That's why if you want to inhibit the peripheral tissues, you want potassium moving out of the cell. So again, GABA for the brain, glycine for the spinal cord. Either way, you're going to cause an influx of chloride into the cell, make the cells more negative, and therefore less likely to depolarize. So that means if I ask you what inhibits anything in the spinal cord, just look for the word glycine in the answer. That means if they ask you how do you inhibit pain signals as it comes into the spinal cord, find an answer with glycine in it. Now there are two chemicals that play a role here in glycine. One is a poison, that's strychnine, and one is a toxin, which is tetanus toxin. So tetanus toxin, as you remember, released by Clostridium tetani, you get it through dirty wounds. If that toxin gets a hold of you, what it does is it causes the inhibits the release of glycine from the spinal cord. Now, watch out for double negatives. If you inhibit the release of an inhibitory neurotransmitter, then you're going to get more activity. That's why in tetanus you get muscle contractions that are very strong, but then they get locked. And that's why your muscles lock, and especially your diaphragm. If your diaphragm locks, then you suffocate because you cannot breathe. Glycine. If you got tetanus infection, it's going to cause the inhibition of the release of glycine from the spinal cord. Strychnine poisoning also does the same thing. So strychnine poisoning was used by some of the spies in the old days. If they got caught on the other side, they would take the strychnine and they would just suffocate themselves to keep from being tortured. So what about GABA? So now GABA's for the brain. That means if you ask me, how do you inhibit any pathway in the brain going in any direction, going up, down, sideways, whatever? The key word is inhibitory. GABA better be in the answer. If I ask you how does a benzodiazepine or barbiturate inhibit muscle spasms, inhibit anxiety or insomnia, then you say, oh, okay, the answer better have GABA in it. If I ask you how does the African sleeping sickness, what would make a person just fall asleep and not wake up again until they die? I bet you there's GABA in it. So there's a way to apply this information. If you talk about inhibitory and you're talking about the brain, your answer better have GABA. If you talk about inhibitory and you're talking about the spinal cord, your answer better have glycine. Now, let's just focus on the parasympathetic system. Parasympathetic system uses acetylcholine for preganglionic and postganglionic fibers. Now remember, all preganglionic fibers use acetylcholine, so it's really the postganglionic fibers that determine the ultimate action. So in the parasympathetic system, it's always acetylcholine, pre- and postganglionic. And that's why whenever they use the term cholinergic, they're talking about the parasympathetic system. So as we said earlier, parasympathetic system depolarizes the head and neck, as well as the sacral area, and then hyperpolarizes the thoracolumbar area. So parasympathetic controls over 90% of the pathways in your brain. As far as the anatomy of the fibers, they have long preganglionic fibers and short postganglionic fibers. Long pre, short post. The way to remember that, think about the vagus. The vagus starts from the medulla. Then it comes down through your neck, through the mediastinum, all the way down into the GI tract. That's about 3 feet later. Then synapses with a celiac ganglion for the GI tract, and then sends out a post-ganglionic fiber, and about 1 centimeter later it touches the GI tract. So very long pre, very short post. Parasympathetic system. Now what about excitatory neurotransmitters? Now there are so many neurotransmitters in your brain, so we're going to categorize it. First ones, what if they ask you about amino acids that are excitatory for the brain? The most common excitatory amino acid in your brain is glutamate. And then the second one is aspartate. Most common, glutamate first. Second, aspartate. And aspartate is part of the Nmda pathway. If you just remember that A is for aspartate, it'd be a lot easier to remember. So one thing I want to show you is how glutamate interacts with aspartate in the Nmda pathway. So we know that glutamate is excitatory. But in the Nmda pathway, aspartate is also excitatory. However, if you let glutamate rise too high, too much glutamate will then inhibit the aspartate. So glutamate, when it stays below a certain level, is excitatory. But when it gets too high, it's inhibitory to the aspartate, and therefore inhibitory to Nmda pathway. This is how 2 drugs used to treat Alzheimer's actually works. They're going to block the glutamate from getting too high. Those 2 drugs are memantine and galantine. These 2 drugs will block the glutamate from getting too high and therefore from exerting an inhibitory effect on aspartate. Therefore, glutamate stays excitatory the whole time. So as far as amino acids, again, the most common excitatory amino acid is glutamate. The second one is aspartate. The Nmda pathway, if you remember, mediates positive reinforcement and or addictions. So when somebody's a gambler pulling on slot machines, their Nmda pathway is firing. So whatever it is you do that feels good to you, your Nmda pathway is the one that's firing that gets you addicted to doing it again, whether it be sports or any kind of activity. What about monoamines? The monoamines are serotonin, dopamine, and norepinephrine. But then if you say catecholamines, then we're talking about dopamine, norepinephrine, and epinephrine. But remember that epinephrine is a hormone, not a neurotransmitter. In fact, I put them in order for you so that you remember dopamine is made first, then you modify it some more to make norepinephrine, and then in the adrenal medulla, then you modify norepinephrine to make epinephrine by adding a methyl group. And what if they ask you who's the methyl donor? Remember, SAM, S-adenosine is a methyl donor everywhere in your body except with nucleotides, where it's tetrahydrofolate. So let's look at norepinephrine. Norepinephrine is a catecholamine and a monoamine. But since norepinephrine starts with NO, remember that, no methyl group on norepinephrine. The methyl group is on epinephrine. So norepinephrine is the main sympathetic system neurotransmitter, and your norepinephrine controls your autonomic nervous system. What is the autonomic nervous system? These are things that happen automatically, like basic respirations, basic blood pressure, basic body temperature, basic functions of the GI tract, GI motility. Norepinephrine controls all of that, your pulse rate. So norepinephrine controls the autonomic nervous system. So anytime you have a drug that blocks norepinephrine function, this is why you always see the term autonomic dysfunction. It means you're blocking the neurotransmitter that controls the things that happen automatically. So norepinephrine. Then here's dopamine. Dopamine is a catecholamine and a monoamine. It's used in 5 different areas of your brain. First, the vomiting centers. Dopamine is the neurotransmitter for your vomiting center. So chemotactic trigger zone on the floor of the 4th ventricle, then area postrema on the blood side of the blood-brain barrier. Both use dopamine. This is why dopamine blockers are great antiemetics whenever you have increased intracranial pressure. So the chemotactic trigger zone on the floor of the 4th ventricle is what's being compressed anytime you have increased intracranial pressure. So head injury, seizures, meningitis, encephalitis, they'll simply ask you to explain, why does a person have nausea and vomiting to follow? Think about migraine headaches. Think about head injury after a fall off a monkey bars if it's a child. Why do we tell the mother the child may have nausea and vomiting, but it's okay as long as it doesn't stay sustained? So vomiting centers require dopamine. So we have anti-dopamine drugs that then are used as antiemetics. The main antiemetic we use in children, promethazine, and adults, perchlorperazine. So therefore, when you read that a dopamine blocker is being used to treat nausea and vomiting, now it makes complete sense to you. Versus you just memorize drugs for a disease, but you don't see the connection. Physiology and biochemistry connect everything together we do as physicians. That's the reason why I want you to understand these 2 topics. With these 2 topics, we can integrate them and figure out just about any other field of medicine that you want to. Now, second area that your body uses dopamine is called basal ganglia. So caudate, putamen, and globus pallidus, they're responsible for gross motor. This is why when you have too much dopamine, you end up having too much motor activity. Or if you block dopamine, then you end up taking away the motor activity of the patient, as in Parkinson's syndrome. So basal ganglia use dopamine. Third area is the mediation of psychosis. So dopamine mediates psychosis. That's why too much dopamine causes psychotic behavior, causes hallucinations, causes paranoia. But too much dopamine also makes you feel very high. That whole sensation of feeling high from a drug like cocaine or amphetamines is based on dopamine. Think about how antipsychotics work. These are antipsychotics. They work by blocking dopamine. So the butyrophenones, the phenothiazines, those all block dopamine. And so that's why it's important to understand psychosis is based on dopamine. And then mesolimbic system is how you get this high that you feel, urges. Dopamine mediates that. And then the final place that dopamine is used is in the inhibition of prolactin. So dopamine blocks prolactin release. The dopamine is in the hypothalamus. And prolactin is released from the pituitary. So dopamine has a negative effect on prolactin. So that's why if you give somebody dopamine, like bromocriptine, or carbagalene, these two drugs are dopamine agonists. They block prolactin secretion. So we use them whenever you have a pituitary microadenoma, which means you have a small pituitary tumor causing the release of prolactin, so you have a galactorrhea and amenorrhea. Yet it's not large enough yet to compress out the chiasm to give you bitemporal hemianopsia. We treat those medically, either with bromocriptine or carbagalene. All you're doing is blocking prolactin. What if you have a pituitary tumor, though? Or you give somebody an antipsychotic? What you're doing is blocking the effects of dopamine, and that means prolactin levels are going to rise. Whenever prolactin levels rise, you therefore block GnRH, so high prolactin. If you elevate it, you're going to block GnRH and eventually TRH. This is why high prolactin cells gives you galactorrhea, milk ejection from the nipples, but then the same woman will end up having amenorrhea. And then eventually, long time later, they'll have hypothyroidism. So these are the 5 areas that I want you to know about the effects of dopamine. That way when we talk about dopamine agonists, you start to understand how it works in the circuit, or dopamine blockers, why they elevate your prolactin and cause amenorrhea. What about serotonin? Serotonin is a monoamine, but it's the main neurotransmitter that controls what we call a reticular activating system. This is the system that awakens you every morning. It is also the system that helps you focus on one motor activity at a time. So notice when you have a disease like attention deficit disorder or attention deficit with hyperactivity, it's the RAS that is the defect. So reticular activating system helps you focus on one motor activity at a time. The main nucleus here is the raphe nucleus. So serotonin serves another purpose. It controls your hallucinations. So what neurotransmitter causes hallucinations? Remember we said dopamine does. Serotonin controls it. All of us hallucinate. We hallucinate as we're going to sleep, when we're coming out of sleep. We hallucinate sometimes when you're just walking down the street. You think somebody's calling your name and you realize nobody's calling your name. So hallucinations are normal. That's dopamine causing it. But then serotonin is the one that controls those hallucinations and says, oh, no, that's just a hallucination. Ignore it and keep going. So every morning when you wake up, you get a burst of serotonin to help control your hallucinations. This is why if you're taking SSRIs, which elevate your serotonin to the level where you throw off the balance between serotonin and dopamine, that's why now you lose that control. That's why SSRIs can cause hallucinations in some people. Or think about the second example. Think about if you don't go to sleep, then that means you cannot awaken every morning. If you do not awaken every morning, your RAS does not get that simple burst of serotonin released to you, which means after a while you lose control of your hallucinations. This is why when somebody has lost a lot of sleep or has not slept for a long time, they start to hallucinate. So serotonin controls your hallucinations. And then serotonin does one more thing. Serotonin controls the perception of anxiety. So serotonin modifies your perception of anxiety by keeping it at a tolerable level. This is why SSRIs are used, and they are very effective in the treatment of the many syndromes that involve anxiety, like panic attacks and phobias, social phobias, PTSD, premenstrual dysphoria disorder, eating disorders, as well as depression, obsessive compulsive disorder. Notice SSRIs are making a huge splash in the field of medicine because now we're understanding that serotonin mediates the perception of anxiety. So either you give the body more serotonin so that it will decrease the perception of anxiety, or you decrease the perception of it through the brain's mechanism. Well, how does the brain inhibit anything? Remember, Gaba. That's why when you have drugs like pregabalin, Lyrica, that's why they're also used to treat people with anxiety. So remember what I said earlier. Anytime you talk about the brain inhibiting something, GABA is going to be part of that explanation. So that's serotonin and its functions. Now what about polypeptides? Polypeptides are ones like CCK. CCK, remember, is a hormone also in the GI tract, but in the brain, it's actually a neurotransmitter. The main one they like to ask about is substance P, because you have substance P and then neuropeptide Y. Substance P is blocked by a drug called capsaicin. Capsaicin will block substance P. P for pain. So this is the main one I like to ask about. Substance P mediates pain. And so capsaicin blocks substance P production and release. Therefore, anybody who has too much capsaicin in their system, you're going to block substance P and therefore decrease pain sensation. Well, capsaicin is isolated from red hot chili peppers. This is why people who eat a lot of red hot chili peppers will have a high threshold for pain, because you've got a chemical in your body that keeps blocking the neurotransmitter for pain transmission. The other polypeptide is neuropeptide Y. It's kind of found everywhere, but it mediates so many things that it's really non-specific.